This is Dr. Cottrell, and what we're going to be looking at is an arthroscopic ACL reconstruction using patellar tendon graft. First, you'll see some pictures of a knee, and here's the medial compartment showing the thigh bone up top and the shin bone down below and a little bit of the medial meniscus cartilage on the right. These are all intact in this picture here. Here's the notch showing the center of the knee, and the structure you see in the middle is the torn ACL. In the next picture, you'll see the lateral compartment of the knee showing the lateral meniscus cartilage is normal here, as well as the shin bone down below, or the tibial surface. And then this picture shows the back of the kneecap up top and the end of the thigh bone on the bottom. And then again, that looks pretty good here. Here's a picture after I've removed the torn ACL. And now you'll see the video of the procedure as the tunnels are drilled so that I can pass the graft. This is a little pin over which I'm using a reamer to drill a tunnel in the tibia or shin bone. And then the same reamer is used to drill what we call the femoral tunnel into the back of the thigh bone where the graft will be passed. And there's special calibration on this drill or reamer so I know how far to drill it. Next, you'll see how I use a long pin which has an eyelet on the end after I passed it through from the shin up into the thigh bone and actually out the skin of the front of the thigh. And then that pin is used to pull some big stitches holding the graft. That's what you'll see here in just a second. There's a stitch pulled up into the knee, and then here comes the graft. And there's a bone on the end. It's been fashioned already to fit directly into that tunnel. You see it fits nicely in there. That's the bone plug on the we'll call the femoral side and the thigh bone. And then the graft goes down from there into the tibial tunnel. And there's another bone plug down on the tibial side or in the shin bone. And on each side I fix it with a special screw. Here's the screw, which is actually bioabsorbable in this case, meaning that there's no metal in this screw. But as you can see, it goes in there and squeezes the graft in place in the thigh bone tunnel. And that's a very secure fixation, meaning that the knee can start moving right away, which is very important because there's immediate rehabilitation after the surgery. And the full recovery after an operation like this can take 6 months or longer. But you can see how the knee moves now, and the graft is stabilizing the knee.